Major funding for Frontline is provided by the Corporation for Public Broadcasting. Additional funding is provided by this station and other public television stations nationwide, and by the Chubb Group of Insurance Companies, for over 100 years providing worldwide business and personal insurance through independent agents and brokers.
Tonight on Frontline, the big business of health care. Profit-making corporations now run 1 in 6 U.S. hospitals. Good for free enterprise, but a threat to public hospitals which treat the poor.
They came in and told me that they was going to have the surgery Tuesday. Then they come in and said no, that they couldn't find no way for me to pay for it because I didn't have no insurance. So they told me they couldn't do it.
It's a medical emergency with potential life and death consequences, a crisis at General Hospital.
From the network of public television stations, a presentation of KCTS Seattle, WNET New York, WPBT Miami, WTVS Detroit, and WGBH Boston. This is Frontline.
Good evening. I'm Judy Woodruff. 25 million Americans are unprotected tonight, unprotected because they have no health insurance. In just the last year, health care costs have gone up at almost 3 times the inflation rate, so that as a nation, we now spend a staggering $322 billion a year on staying healthy. Government officials and insurance companies have pushed hard to cut these costs, but so far with no real success. As a consequence, people are beginning to be turned away because no one will or can pay for their medical treatment. Tonight, producers Graham Chedd and Andrew Liebman take us to Tampa, Florida, a city like many others, where the public hospital finds itself under attack on all sides and has started to cut back on medical care for the poor. It's the story of the crisis at General Hospital. One final note, the film contains some graphic medical procedures.
I gotta pee.
This man's just been stabbed near the heart.
Hold still, they'll need it.
I gotta pee now.
No, you gotta wait.
I have to wait, God damn it, I gotta pee.
Robert, we need a chest x-ray.
Like most victims of medical emergencies in Tampa, he's been brought to the emergency room at Tampa General Hospital.
What time about did this happen? Last half hour?
The big question for the emergency team: has the knife nicked an artery or punctured a lung?
Shoot the x-ray.
No one here is thinking about another question: can the victim pay for his treatment? It's an emergency. Medical tradition is treat first, ask questions about money later. But at Tampa General, hospital traditions have begun to clash with harsh new economic realities.
You're a lucky fella. Wow. You could be dead.
This institution has a history and a tradition of providing health care to anyone that comes through its doors. It's never turned anyone away. It's provided the service that's necessary for minor and serious illness. We'd hope that this can continue. Certainly there are increasing pressures on this institution to remain financially stable.
In Tampa, and in hundreds of other communities across the nation, a medical drama very different from those we usually see on television is being played out. Here, it's the hospital that's fighting for its life. Tampa General, a large, not-for-profit community teaching hospital, wakes to another day. But it finds itself in new and baffling times. It's facing a public angry over rising hospital costs. It's losing its economic base. It's paying patients to new hospitals in the suburbs, many run as for-profit businesses. It's taken on a huge new debt, has just laid off over 300 staff, and for the first time in its history, has begun to turn away the sick. Joe Lowe knows none of this. He's here today after months of illness, losing weight, strength, and the ability to work. But the hospital's new policy is that except in emergencies, patients without funding, private pay patients in hospital jargon, are to be sent away.
When he came to the screening area of the clinic, the registration area, the clerk that works for me brought me his chart and said that he was not eligible for our clinic services because he was private pay patient.
Now, if I was able to come in this hospital and was able to pay my bill, I think I'm supposed to pay it. See? But I'm not able. I don't have no income or no kind, no job, no insurance. So therefore, you know, I'm out of it. I ain't got nothing. And I figured, well, yeah, they're supposed to help me because I ain't able to do it.
Tampa General is the city's hospital of last resort. It's always taken care of the poor and the indigent with only minimal help from local taxes. But today's church-sponsored soup kitchen is a sign of the times in Tampa. So many people can't pay their hospital bills that the hospital's profit from its paying patients no longer covers all the costs of charity care. That, at least, is the hospital's contention in an escalating war of words over local taxes. Today is to see another confrontation between the Hillsborough County Commission and Tampa General's director, Julian Rice.
Well, we're going over there to talk about the budget situation as it relates to the hospital authority. And I guess in particular we're going to talk about the amount of funding required to take care of the indigent load or the charity load in this county.
In part because this funding is so low, the hospital claims that for 1984, it will be $11 million in the red.
We're concerned about your $11 million. I assume that's your problem, but I feel like we've got to help you with it some way. But what are you going to do if you don't come up with $11 million? What's going to happen?
Commissioner, we've already started last March, and we started in July, and we started this month, and we'll continue. And we'll have to make some changes in the amount of services offered.
You're going to save $11 million?
I don't think so, Commissioner.
How much are you going to save? What's the problem then?
We're going to sure try to save a lot of money. But the reason, in the process of saving, there are going to be a lot of sick people that don't get cared for in this community. And that's already started occurring in both the outpatient clinics and the emergency department. We've cut our emergency department visits by 1/3 in the last 2 weeks. And if they don't have the money or are not certified local welfare or Medicaid eligible or Medicare, and they're not life-threatening, we don't treat them.
Take the case of Dora Mosley, a 47-year-old widow. She suffers from a heart condition that will one day kill her. Her few assets, her trailer, an old truck, her $300 a month widow's pension, disqualify her from government assistance. A few weeks ago, in a state of collapse, she went to Tampa General.
I went to the emergency room. They examined me, and I stayed in the emergency room from about 2 o'clock in the evening until about 10:30 at night. When they run all kind of tests, they hooked me up to the heart machine and everything, and they had me doing push-ups and rated my heartbeat and all of what they do. And finally, they decided to admit me.
Mrs. Mosley will need surgery because when dye is placed into the left...
The test shows that Mrs. Mosley's heart has a badly leaking valve.
This leakage in the valve will result in heart failure if allowed to proceed over a period of time.
And they came in and told me that they was going to have the surgery Tuesday. Oh, fine, sooner the better, I was scared, of course, but sooner I get it over with, sooner, it'll be better. Then they come in and said no, that they couldn't find no way for me to pay for it because I didn't have no insurance. So they told me they couldn't do it.
She was not rejected because we have anything, obviously, against Ms. Mosley. We think she ought to be done, but we think someone has to face the responsibility of paying for this sort of care, and we don't think that responsibility is Tampa General Hospital.
But I realize that they've got their job as well as anybody else has, and they have to show a profit and all of this, and everybody's got to do it. It's just the way the economy's a getting.
With chronic congestive heart failure, which is her major problem, and a recent episode of severe heart failure necessitating her hospitalization, I would anticipate several more of these episodes occurring in the next few months.
Every day without surgery, Mrs. Mosley's heart grows weaker. But by refusing her surgery, Tampa General is saving $20,000 and helping ensure its own survival.
I've been accused by a good many of my friends that, well, you're heartless, you do these things, you turn people with, why don't you treat them, and so on. And it goes back to the old analogy, you don't make omelets without breaking eggs. And we're breaking a few eggs, I'm afraid.
Others are being shut out of Tampa General even if they qualify for financial aid. Beth Ford, a young mother of two, has come to Tampa General's emergency room for the second time in the last few days. She was turned away before, even though she's eligible for Medicaid. Medicaid is run by the states under federal guidelines. The program was set up to pay the health care costs of the poor.
What brings you to the hospital today?
I've been sick for over 2 weeks. I've had diarrhea and nausea, throwing up, and it just seems to be getting worse.
But Tampa General gets so little from Medicaid for treating outpatients that it has started to turn them away if they are not judged urgent.
I passed out about a week ago.
What do you mean you passed out? Do you know how long you were out for?
No, I don't.
It's the nurse's decision.
You think? I'd say urgent, especially with the temp and a pulse.
Let's put a simmer.
A few days ago, Beth Ford was rejected. This time, she's luckier.
That was a real difficult case, I felt, to try to decide whether it was an emergency type of situation or not. Something that's been going on for 2 weeks is not truly an emergency. However, she is tachycardic, her pulse is going fast, and she does have a temperature. So maybe that in the process of the 2 weeks, things have gotten worse.
Florida has the second strictest Medicaid program in the nation. Eligibility requirements are stringent. You must be blind, disabled, or a single parent on welfare.
Sign the X, initial next to the circles. It's giving us permission to bill Medicaid and signing responsibility for anything Medicaid does not pay.
And if Beth Ford should need admission, Florida's Medicaid program will pay only about half of what Tampa General will charge to treat her. The diagnosis is a viral infection. She'll get a prescription and be sent home. But she's been seen by a doctor, unlike most of the people without money who today turn up at Tampa General's emergency room.
Those people don't have anywhere to get any kind of care. Granted, the emergency department is not the place to see a patient with a cold or a patient who's unsure why he has this little lump because he maybe got an insect bite or maybe he stepped on something. But what happens when that deteriorates? Or worse yet, what happens when someone is sent out that has a severe complication, actually dies because we didn't foresee that complication coming? You know, there are nurses' licenses on their line, there's patient care on the line, there's a hospital reputation on the line. It's a bad policy, I think.
It not only makes me feel bad, it makes everybody in this operation feel bad. We sat down this morning and looked at statistics, and we had gone in our Hillsborough County clinics from 690 Medicaid patient visits in the same month of August last year to 90 this year. You've got a charge of operating a business, but the people in the hospital business are involved in caring for people.
Caring for people means that Joe Lowe is being admitted to Tampa General. It wasn't an emergency, but he looked so sick, an admitting clerk bent the rules.
What kind of work did you do?
I was custodian.
So would you say it's been at least a year since you last worked?
It's been longer than that.
About 4 years.
Mr. Lowe's diagnosis? Probable lung cancer. He's not eligible for Medicaid because his wife works.
I've been ill.
And you've been at the Florida Hotel 4 years, 4
It'll be
years,
4
right?
years, the 17th of March.
Right.
This is what I go here 2 weeks.
The final option for financial help is county welfare. Mrs. Lowe's take-home pay is a little over $400 a month.
I know it doesn't seem like you earn that much after you pay rent and your expenses, but you're $220 $21 over welfare level. Anything over $2,600, we can try and get help for, but we'll have to make arrangements for the $2,600.
So at that time, what I do is I set them up on monthly payment arrangements. Mr. Lowe had no income. Mrs. Lowe, I believe, had made a little over $400. Their rent was $150 a month. And I said, Mr. Lowe, could you afford $15 a month? And he said, well, I believe so. So I said, why don't we just do that? But then again, at $15 a month at his age, it would be quite a while to pay those thousands of dollars of bills off. So I don't think the total bill will be paid.
Matter of fact, I think I was kind of lucky on getting in, you know. No money, no insurance or nothing. Unemployed, so you know how that go. So I feel kind of lucky too.
There are some 25 million Americans like Joe Lowe, people with family incomes too low to afford private insurance, yet too high to qualify for government assistance. And in most of these cases, it's the local general hospital that bears the financial burden.
That's about it.
And all of us have prided ourselves on the fact that we have been able to carry this load, and we have done so for many years, of never being given adequate funding for the care of the indigent. And through the payment of the private patients, we have carried this load.
Bill Winfield is one of those private patients that's enabled Tampa General to carry its load of unfunded patients. Victim of a recent heart attack, Mr. Winfield needs bypass surgery. Tampa General has the only open heart unit in town, and bypass surgery is very expensive.
No, I'm not worried about this cost because it has to be done. There is no alternative. You have to take it. Take it, and that's all there is to it. And if the costs are there, they're there. That's all. I'm not a wealthy man, but I have real good insurance, and so I assume that most of it will be covered by that. Hopefully.
In the next few hours, Mr. Winfield's insurance company will run up a major bill, and Tampa General will make a handsome profit. Every minute Mr. Winfield is on the operating table, the hospital charges $9. And that's just for the room, the nursing staff, and the reusable supplies, like the surgical instruments. 170,000 bypass operations are performed each year in the United States at a total cost of $3 billion. Tampa General alone does 40 bypass operations a week, keeping 2 specialized surgical suites busy dawn to dusk. Mr. Winfield's heart is about to get its first rest in almost 60 years. Its task is taken over by a heart-lung machine, which oxygenates the blood and pumps it around the body. This machine alone will cost Mr. Winfield's insurance company $1,500 before the operation is over. A vein which came from his leg is trimmed to the length needed to bypass his blocked arteries, and the heart is stopped with ice water. We are witnessing an operation that epitomizes the soaring costs of healthcare. It's new, involves highly skilled personnel and sophisticated equipment. Most insurers don't balk at the cost, and most patients are too sick and vulnerable and frightened to care. And for the surgeons and hospitals, it is highly profitable. A jolt of electricity starts the heart beating again. The operation over, a good part of the heart-lung machine is simply thrown away rather than sterilized. Total OR charges so far, almost $4,000.
Well, the OR costs stop as he rolls out of here, but then as he goes into cardiac surgery unit, which is the intensive care unit where they are cared for post-operatively, the charges start all over again. Open
heart surgery is a major source of revenue for Tampa General. cardiac surgeon Dr. Dennis Pupello.
I think during the fiscal year 1981-82, total revenues derived from cardiac surgery and cardiology at the catheterization laboratory were about $23 million for this institution.
That represents 1/4 of Tampa General's revenues. And for every dollar it charges on heart surgery, the hospital makes about 40 cents in profit. The physician's fees are separate. Dr. Pupello's group will be billing the insurance company $4,675. 24 hours later.
Keep your eyes open for a minute. Put a thumbs up sign if you want.
Mr. Winfield is one of the 110 million Americans whose hospital bills are paid for by private insurance, and who provide the nation's hospitals with a profit almost every time they are hospitalized.
We're doing fine, Bill. Okay? Tomorrow breakfast at 8.
But if Mr. Winfield is the ideal patient at Tampa General, the hospital is also delighted to welcome many patients with no private insurance at all. The reason? Like Cora Davis, who 2 weeks ago turned 65, they are eligible for Medicare. Medicare, a federal program, spends some $50 billion a year towards the hospital bills of the 30 million elderly Americans like Mrs. Davis.
Are you going to make it by check or how?
No, money.
You've got cash?
Right.
Okay, if you want to give me the cash, I'll take it to the cashiers and get you a receipt. And you wait here and I'll bring the receipt back.
Said
$304.
Right.
Medicare requires only a down payment on the hospital bill. For Mrs. Davis, Medicare is a lifesaver.
It's going to be a little stiff.
She suffered for years from a condition that threatens her with a stroke at any moment. She couldn't afford an operation, so continued working as a housekeeper, waiting for her 65th birthday and eligibility for Medicare.
I was just living off of fear and hope and prayer that I could go through with it, before I did have a stroke.
In her neck, an artery is partially blocked. She is x-rayed with a device that reveals the blood vessels. Hospital charges? Almost $1,000. Mrs. Davis is just glad the technology exists.
I think that's why they lose so many patients. They don't have the right stuff to work with. So I think it's beautiful.
The x-ray confirms the problem. Mrs. Davis will need surgery to clear the blockage. The hospital will be reimbursed by Medicare for its treatment of Mrs. Davis according to a complex formula that will, if the hospital is skilled at interpreting the rules, allow it to recover most of its costs. Mrs. Davis is hooked to a brainwave monitor, for the blood supply to her brain will be restricted as her artery is temporarily tied off. Quick action will be needed if her brainwaves start to falter.
She's okay so far.
But they hold steady, and the surgeons can now delicately scrape out and remove the fatty plaque that's been blocking her artery and threatening her life. If Mrs. Davis were privately insured, the hospital would earn $6,000 from her operation. From Medicare, it will actually get about 60% of that, say $3,600. So while not delivering the profits of privately insured patients, Medicare does provide a steady stream of revenue to a hospital. If Tampa General were to treat only Medicare patients like Cora Davis, on whom it breaks even, and privately insured patients like Bill Winfield, on whom it makes a profit, just imagine the money it could make.
Think of Pilron first.
At Pilron we have the best designs for you, the best ideas in mind for you.
The annual convention of the American Hospital Association. An annual reminder of the multi-billion-dollar business the hospital industry has become. And an annual showcase for a group of companies that in the mid-1960s did spot the profit potential of the right sort of hospital.
Hello, welcome to Middle City North Central South Suburban Hospital. I'm nurse's aide
A group of companies that now constitutes an industry growing faster than the computer business, and last year made pre-tax profits in excess of $1 billion.
The state of the art in technology. Wow!
Hospital Corporation of America owns or operates 384 hospitals, annual revenues $3.5 billion. National Medical Enterprises, 60 hospitals, $1 billion. Lifemark, 27 hospitals, $900 million in revenues. Recently acquired by American Medical International, 72 hospitals, $1.6 billion in revenues. And Humana, the most profitable of all, $2.3 billion in revenues from 89 hospitals. And this is the 90th.
Concept to one of the country's most prominent and most progressive healthcare organizations.
The opening in August 1983 of the newest hospital in the Humana chain, Humana Women's Hospital, Indianapolis. And a welcoming speech from Indiana's Lieutenant Governor.
On behalf of the 5.5 million people who live in this state, I say, welcome, Humana. We're delighted to have you here.
Welcome.
It's pretty, isn't it?
The chairman and co-founder of Humana, David Jones, and his basic philosophy.
Women's hospitals, all hospitals, it's the same thing. Understanding what our customers need, making sure we provide it. Unexcelled quality that's measurable. It's a beautiful hospital, and it's a good place where women will get high quality care, and where the price will be right.
It's such a homey atmosphere. It really
This is our 20.
It's for women.
Yeah.
It's
This
done
is
in
our 24.
Jones started in the nursing home business in the early 60s, switched to hospitals soon after Medicare was enacted, went public with his company in 1968, and last year saw Humana gross $2.3 billion.
My wife will see this better.
His latest strategy is to build hospitals catering exclusively to women. But his basic approach was already established 12 years ago, when Humana built its first hospital here in Jones' hometown of Louisville, Kentucky. All Humana hospitals, whether acquired or custom-built, have the same look and style.
Our approach is one of caring and concern for our patients. We call it Humana Care. It's a heightened sensitivity and awareness of the patient's needs and expectations. We
believe that if a patient has a happy experience here, they'll tell 3 of their friends. However, if they have a bad experience, they will tell 11 of their friends.
The key question always is, who is the customer, and what are the needs and values of the customer? And I think our recognition that there were people out there who receive services who have the same kind of interest in the quality of those services that one might have in the purchase of an automobile or in staying at a hotel or something of that sort.
Okay. And if you'll read to me what you would like, I'll mark your selections here on your menu.
I'll take some shrimp cocktail.
The emphasis at all Humana hospitals is on patient or customer satisfaction.
This lobster tail looks good.
All righty.
And I'll take this cherry cobbler.
All right.
And I will take a dinner roll.
Okay, sounds good.
Food,
We need a very tender steak sandwich on a bun, please.
and the customer's personal preference receive a high priority at Humana hospitals. But the most important customer of all is the physician.
I'm going over to the hospital to see that post-op diabetic. I'll be back in a couple minutes.
Okay.
It's the physician, more than anyone, who decides which hospital his patients will go to. By building physicians' offices next to most of its hospitals and renting them at bargain rates, Humana ensures a steady stream of patients from doctors who can simply pop next door to see them.
Yeah, well, that's great.
This is the heart of Humana's operation, a computer installation in Louisville that is in daily communication with the 90 hospitals in the chain. From drug inventories to the ratio of nurses to patients, data on every aspect of every hospital's operation are sent here every night. And every morning, each hospital administrator has a printout on his desk with orders for the day. This centralization is one key to Humana's ability to control its costs. David Jones.
in the 40 standard metropolitan statistical areas where Humana operates, we have a cost advantage of 16.8% per admission compared to our competitors in those markets. Here in Louisville, we have a 33% cost advantage.
Humana may have a significant cost advantage, but this is not reflected in its charges. Here in one of its Louisville hospitals, an upper chest operation is underway. Off in one corner, a vigilant team of nurses is keeping track of every item, from swabs to sutures. It is all recorded for the patient's bill.
Foley catheter was a 16.5 cc.
Studies in California, Texas, and Florida suggest the for-profit hospitals mark up such items as drugs and x-rays more than the nonprofits.
Transfer units, 100 cc's.
They rarely charge less than the nonprofits for a typical hospital stay, yet claim a greater efficiency. One explanation comes from for-profit industry spokesman Michael Bromberg.
I believe that our charges are competitive. I believe that we are efficient and that the two are not necessarily equatable. You can have a brand new hospital built on the corner, which obviously can't be cheaper than the 30-year-old hospital down the street with no mortgage. That doesn't mean that the first one isn't much more efficient than the second one.
Well, that, of course, is the claim that they make.
Dr. Arnold Relman is a prominent critic of for-profit hospitals.
Efficiency, to most people, it seems to me, would imply that they should be able to deliver good health care less expensively, and they don't. They actually charge a lot more than comparable not-for-profit hospitals, and they collect considerably more. All the studies that have been done so far seem to come to that conclusion. It's more expensive, not less expensive, to be taken care of in a for-profit hospital in this country.
But to the mainly middle-class, well-insured prospective customers of Humana Women's Indianapolis, the cost of their hospital care is of little concern.
I've heard about Humana in other parts of the country, but I don't know what their pricing policy is. I know they go for-profit business, and if it's like banking or whatever, you want to hit the upstream client, and the money doesn't seem to make any difference there. So, they may charge more.
But I can't see it being that big a determinant.
It's not going to make any difference to us.
Because we have insurance, so.
Have you considered that?
I haven't considered that either.
If Humana hospitals are more efficient at making money than most of their competitors, they are also more efficient at collecting it. All billing is done centrally from Louisville, where there is also an effective operation to ensure that the bills are paid.
A copy of the card for this month, and then I'll see if we can't get it billed.
$452.92, and it does need to be paid in full.
Joseph Beecher, please.
Okay, ma'am.
This is Miss Kay. The only final time on the balance. We're trying to exhaust every possible means of it.
Humana Hospital McFarland, and I was calling about an account that had a balance of $45.10.
Humana is the most profitable of the for-profit hospital chains, in part through a shrewd policy of targeting the most profitable patients. Nowhere has the policy been more successful than in Tampa, Florida, where Humana Women's is the most profitable hospital in the chain.
Whoops. Congratulations on your baby.
Thank you very much.
Deborah and Kevin Keelan are celebrating the birth of their daughter Kelly with a traditional Humana postpartum gourmet dinner of stuffed shrimp and filet mignon.
Thank you very much. Here we are, sweetheart, to Kelly.
They chose Humana for the same reasons most people do.
How did I come to choose this hospital? Well, to be honest with you, I have friends that have had babies that have raved about Women's Hospital. And so naturally, when you get in the condition yourself, you start thinking about what to do. One thing is location. Had a lot to do with it because we live on the north side of town, and this hospital is very convenient for the two of us to get to.
Like most Humana hospitals, Tampa Women's is in a growing, affluent neighborhood.
Money is of no consequence whatsoever when you're dealing with life. I've never been obsessed with money, but what we've got now, money couldn't buy that. It really couldn't. And if it meant mortgaging my house, my pool, whatever, my cars, whatever, I would do it. So money is
it really isn't of importance to me.
For people to whom money is a problem, Tampa Women's is not an option. For them, there's only one hospital in town they can go to, and that's Tampa General. Christine McKinney has no private insurance. Now at Tampa General, she first went to Tampa Women's.
They just told us, they says, you either give me $1,000, $25 cash, or we just transport you over to Tampa General. And my husband says, well, do you carry that kind of money in your pocket? Could you hand me that? And she says, no. He said, well, I can't either. And so we just come over here. We didn't have any problems at all with people here. They didn't treat you like, just because you didn't have that kind of cash on you, you were dirt.
I've never experienced before where a private hospital in town would be so exclusively private to cause the hospital in town that does accept indigent patients by nature of its charter reach the dilemma that we've reached right now.
Dr. J.K. Williams is head of the high-risk pregnancy unit at Tampa General.
Historically, Tampa General Hospital has been expected to survive by attracting enough private patients so that the bills of the private patients would pay the bills of the indigent patients. Now, with the growth of Tampa in the last few years, and with no other hospital in town willing to accept a single indigent obstetric patient, by nature, they all have to come here. And they totally fill our beds. So if you speak purely from an obstetric standpoint, this hospital is losing considerable amounts of money by accepting patients who cannot pay for themselves or have insurance.
This is the core of the crisis at Tampa General. 90% of the women who come here have no private insurance. And 50%, over 2,000 women a year, neither have insurance nor qualify for any financial aid. In every one of these cases, including Mrs. McKinney's, Tampa General risks not getting paid at all. Her baby is likely to be very expensive. It will be born by cesarean section. 2 previous pregnancies ran into trouble, and the baby is being delivered 6 or 7 weeks before term.
Nice size.
That's what you wanted. Yay. Cassie's 22. One. Yep. Got it? Yep. Good baby.
The baby will need a period in the newborn intensive care unit. These units are among the most costly areas of a hospital.
Come on, Pumpkin.
A lot of staff and technology are needed to give premature babies a good start on life.
Oh my God, he's 4.5, 4.8. Knew he wouldn't make it.
Even though she'll be here for only 3 days, the baby's bill alone will come to $3,000. Across town in Humana Women's intensive care unit, Kevin and Debbie Keelan are visiting their new daughter. Also delivered by cesarean, Kelly's first few days of life have been difficult and expensive. The Keelans' total bill will be at least $13,000.
We have insurance, very good insurance, but if it meant that we'd have had to fork out of our own pockets, we certainly would have done that.
Christine McKinney's bill will total $8,400.
Well, my husband's been working 60 to 70 hours a week. He's going to keep doing it, and that's the way we'll pay. So much a month. Monthly payments is like paying rent.
Despite good intentions, many unfunded patients never pay off their total bills. And in accepting these patients, while losing the paying customers to the for-profit competition, Tampa General is by no means unique.
My guess is that there are scores, perhaps even a few hundred hospitals around the country, like Tampa General, that are struggling to stay alive as they try to meet the competition from hospitals that are skimming all the private paying patients away.
Tampa General has been losing the competition for years, and for the same reason as the other large old hospitals around the country.
Our biggest drawback right now is the physical plant. We have a labor and delivery unit that was designed a number of years ago for approximately 800 deliveries a year. Well, we're doing 4,500 deliveries. Patients are on top of one another. Private patients aren't going to accept that.
And they don't. Humana Women's is now the hospital of choice for most insured women in Tampa, including many on the staff at Tampa General. Other private hospitals in Tampa have also been drawing the insured patients away from Tampa General. Some of these hospitals belong to for-profit chains, like American Medical International's Memorial Hospital. But Tampa General has now committed itself to fighting back. 2 years ago, it borrowed $160 million in the bond market and began a major reconstruction and expansion program. It's aiming not only to upgrade its existing facilities, but to build what it hopes will be major new sources of revenue, such as a $5 million rehabilitation unit.
Come on, Richard. 24.
6 weeks ago, Richard Reeves was in a car crash that paralyzed him from the waist down. He's at Tampa General's existing rehabilitation unit, which is small and overcrowded.
Aw, you can't give us one more? Oh, come on, do it. No.
Accident victims like Richard Reeves are a good source of revenue to a hospital. Workers' compensation covers many who aren't privately insured. Richard's bill will be over $30,000 before he leaves, and the hospital can expect to collect on it all. The new rehab center should help many more like Richard Reeves and the hospital's cash flow. But Tampa General isn't alone in spotting the value of rehab programs. A proprietary for-profit chain now has plans to build a competing rehab center in Tampa.
We're concerned because we know from our experience elsewhere, with respect to, for example, the obstetric service, that the proprietaries will not accept some of the unfunded patients, and they will take more of the private paying patient, and we will be left with a poor mix of patients in terms of their financial ability to pay for the service.
Our investment bankers say we have to meet these challenges, that we can't sit back and allow our share of the market to be taken away, that we have to fight for it like any other business would.
And now Tampa General has a new fight on its hands. Bill Winfield, 3 days after his bypass operation, takes his first walk. His hospital bill now approaching $12,000.
Well, here I go. This is the Tampa Marathon.
A major reason Tampa General was able to sell its $160 million worth of bonds was its monopoly on the lucrative open heart business in the Tampa area.
Best exercise a man can get.
But now that monopoly is crumbling. The surgical team that operated on Mr. Winfield and half of Tampa General's other open heart patients is planning to move most of its business to another hospital. What did it take to persuade them?
Well, it took a great deal. Of course, we were given the things that we needed, and that's what precipitated the move.
The hospital that lured them away is St. Joseph's, a private hospital that's highly successful in competing for insured patients, until Humana Women's opened across the street and captured most of its baby business. St. Joe's response? Get out of babies and into hearts, remodeling its obstetrics unit into an open heart suite and giving Dr. Pupello everything he needs to run it. And that's not the only threat to Tampa General's heart business. There are also plans for a for-profit heart institute in town.
It's accepted that you can't have the only show in town. Now, hopefully, there won't be one on every corner, and that's what we really are concerned about. 3 or 4 more of these activities in every neighborhood will put this hospital in serious financial situation.
Even as Tampa General fights to keep its remaining lucrative patients, it faces a new challenge at the bread and butter end of its business, Medicare. Cora Davis is having an expensive CT scan of her head. Her earlier tests showed up an unsuspected problem, a possible tumor beneath her brain. She is one of the last Medicare patients whose hospitalization will be paid for according to how much the hospital spends on tests like this. From now on, hospitals will be given a flat fee depending on what illness a patient has. The goal is to hold down Medicare costs. Mrs. Davis does have a tumor. She'll need to come back to Tampa General in a few weeks to have it removed. Meanwhile, her artery surgery has finally lifted from her the fear of suffering a stroke.
I think it's worth it. Because it's like the doctor said, if I hadn't went through with it, I would say it was a stroke and I'd have been blipped out. So, and the way I'm feeling this morning, I thank God for it, that they had such a thing as that.
The new Medicare payment scheme is causing hospitals a lot of anxiety. Bill Winfield's insurers will be paying his bill, but the question of how much Medicare will pay for open heart surgery like his is a vital concern to Tampa General. And today, as Bill Winfield's being discharged, the new Medicare price list has just arrived.
That's tremendous.
Yeah, that's right. We do well with that.
Oh, yeah.
We can cut that about half.
20 days. Coronary bypass without cardiac caths, 13.5 days. We'll make out like bandits.
That's right.
I can tell you one thing we better do. The investor-owns will know which of those DRGs are unfavorable, and they'll be out of those programs before we realize what the impact will be, and we'll be stuck here with the same losing programs that public hospitals always have.
What this will do is to give us information on those that appear profitable. We can concentrate our marketing efforts. We can concentrate our facility development, our capital acquisition efforts on those diagnoses where we think we can really make some good money.
You know what that'll mean then? That'll just mean that Tampa Heart...
Discussions like this are now taking place across the country. In a political climate where cutting hospital costs is a national priority, competition for the profitable patient is intensifying. Meanwhile, the 25 million Americans like Joe Lowe with no funding of any kind are increasingly unwelcome. The for-profit hospitals make their money by avoiding cases like his, and he's now here at Tampa General only because a clerk bent the rules. The tests he'll get will rule out cancer, but he has a serious lung disease. No hospital will ever make money treating it.
As health care is increasingly seen as a business, like any other business, the sense that we have an obligation, a social obligation, to pay for the care of those who can't afford to pay tends to disappear. And wherever for-profit health care comes into the picture, philanthropy and community responsibility begins to wane.
An early victim of the new times is Dora Mosley. 5 months after being turned out by Tampa General, her heart is still unrepaired.
Now is the best time because all of my heart is good, but the 2 valves. The muscles is all good, and it would take now. If I wait, there's no change. There's no use going in.
Dora Mosley's heart can still be saved, but time is running out. Time is running out, too, for Tampa General. Before it can once again help Mrs. Mosley and the others it's turning away, it must first save itself. But has it left until too late its attempts to attract back the paying patients it needs? This hospital did leave it too late. A large urban teaching hospital, it too faced Tampa General's problems. Its paying patients went to new for-profit hospitals in the suburbs, and it was left with only the indigent patients. To pay for their care, it needed more and more tax dollars. So it began an ambitious reconstruction program to bring back the paying patients. But by the time the new building was completed, it couldn't afford to open it. The hospital is the University of Louisville Hospital in Louisville, Kentucky, hometown of Humana. So, with a brand new building and no one to run it, the University of Louisville Hospital became Humana Hospital University. David Jones brokered the deal personally. Humana is leasing the hospital, and in return for guaranteed tax support will take care of the city's indigents.
We're real well pleased with the facility.
It's an unprecedented move for Humana, contrary to its usual policy of buying or building smaller suburban hospitals. For Jones, this is a showcase and a gamble that the for-profit approach will work in a community hospital.
It's an innovative concept that needs a chance to prove itself. If it does prove itself, perhaps we can do that in Tampa or other places where the community hospitals are having difficulties. I don't promise that we can change the world, but we're the first to make this attempt. This is the only community in America whose indigent care problem that I know of is actually tied down tightly for a 4-year period. And that comes because we're profitable, because we've covered that cost.
It also comes because taxpayers have guaranteed $20 million a year to help cover the cost. It's a gamble Louisville hopes Jones will win as much as he does. And it's an experiment with dramatic implications, which could mark the beginning of a major new direction for the for-profit hospital chains. In Massachusetts, for example, prestigious McLean Hospital, affiliated with Massachusetts General, was almost sold to the Hospital Corporation of America until the medical faculty vetoed the deal. Their concern? That the traditions of a teaching hospital weren't compatible with for-profit ownership. George Washington University Hospital has also talked with several for-profit hospital companies. With 10% of the hospital industry already under their control, it's an irony that the for-profit chains, with their power to raise money in the stock market, are among the few institutions with the financial muscle needed to save the nation's threatened public hospitals.
The simple fact is the public sector in this country can't do it alone. And there's no choice. We're the only hope of financing quality health care in the future, and we're going to be here and we're going to do it.
It's everybody's problem to look at whether this is or is not the appropriate way to treat people, and indeed whether profits out of illness are really appropriate. Frankly, I can't help but think that's somehow it just doesn't make sense to me. I don't own any stock in any of them.
I think most of the health field has traditionally been for-profit, except for the hospital field, which has been 90% nonprofit for many, many years, and that's the one that's accused of the most inefficiencies. So I think the burden is not on me to defend it so much as it is on others to say what's wrong with profit. It's what made this country great. So I think profit is American, and I shouldn't have to defend it.
Is that the ultimate answer? A financial success? I think the healthcare system in this country is, I think, different from the automobile industry. It has to be. I mean, we're dealing with human beings. We're dealing with people's lives.
Mr. King, what happened to you tonight?
I was walking down the Palm Avenue.
At Tampa General, the daily battle for survival continues. Even as it cuts back on services and turns away non-urgent cases, it continues, too, as the hospital of last resort for those in an emergency. Even those like Mr. King who've been turned out by other hospitals.
He told you to come to Tampa General?
Yeah, I did turn up.
Mr. King is a classic example of a patient who winds up in our emergency room, triaged from another emergency room, basically because he has no really way of paying for his care. And I think it's understood that eventually if they wind up at Tampa General, they'll get taken care of.
That's the way it's always been. But with hospitals like Tampa General already shutting its doors to the poor because of the bottom line, what sort of health care will millions of Americans get in the future?
Get the stitches out.
Who do you see though? Any special one?
County clinic. Just walk in.
Tampa General lost $12 million in 1983, and the crisis there is getting worse. Dr. Popello, the heart surgeon, moved his practice. That will cost Tampa General another $300,000 a week. Press reports have suggested the hospital is mismanaged, and a new top administrator has been hired. Whatever the cause of these problems, the situation does illustrate the economic pressures on all public hospitals. A presidential commission has said society has an obligation to ensure equal access to health care. But the Commission also said that each individual must pay a fair share. The questions facing all of us: should every American have the right to the best health care money can buy? And who will pay for those who cannot afford to pay for themselves? And on a personal note, last October, Jessica Savage was killed in an automobile accident. She was the anchor for the first season of Frontline. She was a colleague and a friend. As a professional, she gave us her enthusiasm, energy, and support. As a friend, we will all miss her. Next week on Frontline, a side of modern industrial Japan we rarely see. A seldom told story behind the Japanese miracle. A tale of America, Japan, automobiles, and the workers who make them.
I believe it's going to be the best place I've ever worked.
A journey from Tennessee to Tokyo, and a different image of Japanese labor relations. We've given it the title, We Are Driven. It is next week on Frontline. I'm Judy Woodruff.
For a transcript of this program, please send $4 to Frontline, Box 322, Boston, Massachusetts, 02134. Frontline is produced for the Documentary Consortium by WGBH Boston, which is solely responsible for its content. Major funding for Frontline was provided by the Corporation for Public Broadcasting. Additional funding was provided by this station and other public television stations nationwide, and by the Chubb Group of Insurance Companies, for over 100 years providing worldwide business and personal insurance through independent agents and brokers.